All right, everybody, come on in, come on in. All right, come on in, everybody, come on. I see we just went live on YouTube, and I think we're live on Facebook. Hi, folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
All right, Brad, show the ridiculous outfit you have on right now. Go ahead, stand
I'm
up.
trying to get some sleep, Bob. Would you just leave me alone? This is the way it is.
Oh my God, those pants are obscene, actually.
Oh, thank
If
you,
you see the little symbols on there. Today, Brad, we're going to talk about everything you need to know about bed positioning for sciatica, back pain, neck pain, shoulder pain, hip pain, any type of pain.
Right, you got to get some sleep, get rid of the pain by, these some helpful hints.
Right, because if you have pain at night and you're not sleeping well, you're not going to heal. You need to get sleep to heal. So we're going to go over all these things today, and then the way we run things is that at the end of the session, we'll try to get through our information first.
Sure.
And then we'll take questions at the end. If you are new to our channel and you're watching us on the rebroadcast, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you're not already on Facebook, and hi, everybody on Facebook, give us the likesies and the thumbsies. Make sure that you go over to Facebook and like us because we give away free stuff and because Brad and I like to be liked. All right, Brad, take it away.
Oh, sure. I'm getting kind of tired, Bob.
All right.
All right, where were we? Oh, if you're having a problem with sleep, I think the first thing is your mattress. We're not going to get into this into detail, but there's always I have patients ask me, should I have a firm mattress, should I have a soft mattress? And to be honest with you, everybody is a little bit different.
They are.
Generally, maybe a little firmer, but not for everyone. I'll give it a good example. Over the weekend, I was at a cabin. I slept on one bed. I could hardly sleep. I was tossing and turning. Oh, I don't like this bed. The next night, it was a softer one. I slept like a baby. I would have been taken home with me, actually.
You got into a different bed?
Yes.
Oh, you did?
You better believe it. Make sure you get the right mattress for you.
We do have a couple of hints for that. There are those mattress toppers that are like egg crates.
Sure. Yeah.
We've had some patients that, especially they feel like their bed's too hard, they put that on the top. Also, if your bed is sagging, we got to make the comment, Brad.
Yeah.
Take some plywood and put it between the mattress and the box spring, and that'll solid it. Make it more solid. So that
right. I mean, you can just go buy a new mattress and stuff, but that if you don't
when you're poor, you don't have we had to do this. So, and you can also take the mattress and put it on the floor to see if a firmer mattress would be good for you.
Right.
And it'll give you some support.
Right. As opposed to buying one and then finding out this is not really the right one for me.
I think there's a website called Sleep Like the Dead. And, it actually has good advice on mattresses. I think that's what it's called, something like that.
Good. So, anyways, get that established. Do a little homework on it, and you'll know when you have the right mattress because you'll sleep much better. Now, we got some other simple things before we get into the positioning. Oftentimes, Bob, you're in my way.
Oh,
just getting the room dark. There's lots of places in the world that stay light, almost 24 hours a day at certain times of the year. Or if you're sleeping the day, you work night shifts, get yourself some of these. Now, these eye things are they look like a little bra, actually. My wife was just...
Brad, it's a family show. Come on, watch out.
Brassiere, sorry. But, get these and get them on, and it really, you can relax, and things are completely black right now. And use that. And also, Bob, you want to talk about white noise?
Yeah, obviously, a lot of times if you can drown out any extraneous noise, we always use a fan in our house. Here's a little bit of a air freshener, right? Or what do you
know? That is a purifier. That's a filter. Actually it's a very fancy filter. But if you're gonna have a fan, push the button.
How come it's not turning on? It's plugged in, right? There you go.
It wasn't plugged in on the back side. But you get the noise from the fan, and also you're purifying the air. Especially in the wintertime, things are all closed up. It's nice to know that you're breathing some decent air.
Sure.
But it gets two birds with one stone. Between that and the night things is a good way to start either one of those issues. The white noise is just, we we have it just for the noise part.
And you can use earplugs too I always use earplugs when I'm at a hotel or anything like that.
You do?
Yes, absolutely.
You must have some pretty wild
I don't
hotels.
have. Yeah, well, if there's any noise at all, I won't sleep. So should we start talking about neck position, Brad?
Right, yep, we'll start from the head and go down.
Sure,
pretty much.
sounds good.
So when you're sleeping, could you throw me another pillow,
Yep.
Bob? If you have a thick pillow or you have a tendency to put two pillows on your head, maybe you're watching TV, you got a TV that in your room and you're like this, you know, it might be good for watching the TV, but it's not going to be good for your neck.
It's really not even good for watching TV either.
Yeah, I don't
mean,
watch
it's not
TV,
good.
so I
It's
don't
not
know.
good for your neck to be in that position.
Right.
I mean, I think the alternative, Brad, would be to use the. Where's the other one?
Oh,
Can you show
sure.
this real quick?
Yeah.
So if you regularly watch TV, I would go ahead and get one of these.
Sure.
What is this one called, Brad?
That's the wedge.
Not the leg wedge,
No,
just the
this
wedge.
is just a sleep wedge.
Sleep wedge,
Yeah.
okay. So now, especially if you come up a little bit higher, Brad. I mean, yeah, there you go.
There you go. Oh, yeah, that really, when you get that to the low back, is this
Yeah.
part right in here, it makes a big difference.
So now, as you can see, his ears are kind of still lined up with his
Right.
shoulders instead of being forward like this.
Right, I'm not gonna stack two pillows in here
Right.
to get this.
So he can watch the TV, he can read a book without putting stress on his neck.
Right.
But let's go back to the position with the bad position, Brad. So, yeah, in this position, when you got two pillows or three pillows all night long, you're not keeping the neck in neutral, what we call. At any degree forward like this is putting stress on the neck.
And it's harder to breathe.
Yeah, it is. So, yeah, these are used for people who have difficulty with breathing too, right, Brad?
Sure, yeah,
And,
oh, yeah. Breathing or, with the lungs, that
And the reflux disease,
yeah,
GERD.
GERD, very good. Okay, now if you're a side sleeper, then it's a different story because a thin pillow is too thin because you got your shoulder here taking up space and your head goes down. We want to keep that head in a neutral position.
Right in the middle. So again, you can double up.
Yeah, this is what I do. I just double up. Although I'm not a side sleeper very often, so that's not a problem. But there we go. Now where's that white stick, Bob? Right behind you in the corner.
Here it is.
Yeah, show what they mean. So if we're looking at a neutral position,
Sure.
right up the midline, we're gonna
It's
call
all
that.
lined up.
And if I'm down like that, your head is not in the neutral. Get it up there, fill it up in the pillow. Or you can have two pillows and
The other alternative, Brad, for this is if you buy one of these. Now this is a memory foam pillow with the design. Now it's got a thicker side. Yeah, I don't know if you can see this. It's got a thicker side and a thinner side. So when you lay on your side, you put the thicker side up here.
Sure.
And then when you lay on your back, you can just put your neck right into there so that you're not onto the thicker side.
Yeah, these memory foam pillows are really, really nice. I just like the way you sink into them and then you stop when the pressure they just work out.
Well, but I'm going to make a disclosure, Brad.
Say it.
I hate these things.
Oh, wow.
I do. I tried them. I just don't like them. It's a real personal thing. I mean, I did put one down below in our links below that you can look to. We got our Amazon page of products we like. But I will say my daughter loved it.
Right.
But it took her 2 tries. She bought one, and she didn't like the firmness of it. And then she bought the other one. This is the one she bought first, and she didn't like it. And the second one she loves, and in fact, she was having headaches at night from her jaw, and this took it away.
Sure.
So it's I don't want to be a big seller of this, saying that this is going to solve your neck problems, when it might, when it also you may hate it. So it's just a personal thing.
It is. Everybody's body's built different, the bed and whatnot. So, but they are certainly in certain cases. My wife loves hers.
You want to show some of the alternatives to that, Brad?
Sure. Wow. Yeah. I'm trying to get some sleep here, Bob, and you keep interrupting me. Sometimes you need, like the memory, if you don't want to spread the body on a memory foam pillow, you can kind of make your own. You take a towel roll like this, and you can either just put it here or put it inside the pillowcase. And it's going to fill in that gap and support your neck, that cervical column right there. You probably can't see it very well, but it's right where my hand is. And that feels good. A lot of times people with neck problems, patients, I'll have them do this. Now towels don't work quite as good as if you get.
Yeah, this is a McKenzie cervical roll. McKenzie, McKenzie.
Good job.
Cervical roll. And
that's
it's made for this.
Yeah.
So this is a kind of a good alternative too, Brad. Now this I think I could tolerate. And you would probably put that there, and maybe if you're on your side, probably have two pillows, maybe even, right?
Oh yeah, possibly. Yeah.
I mean,
Bundle
up, or yeah. Again, you're gonna have to figure out what works for you. You can also sleep on your back with the Mackenzie roll like that. See how it gives some support in there?
Yeah.
So lots of alternatives. Now I saw someone, Brad. I don't know. Are we done with the neck?
Yeah, I think that covers the neck.
Okay. I saw someone that was just mentioning that they sleep on their side at night and they sleep on their shoulder. So we need to go over that.
Right. That's a good point. No pun intended. The point of the shoulder.
That's
get it?
right.
Ha, ha, ha.
So what we recommend for that is if you're going to sleep, first off, try to avoid sleeping on a bad shoulder. I mean,
Right.
you want to sleep
That's
on your
good
good
way
shoulder
down.
if you can. And if you're on your good shoulder, should we show that right away, Brad?
Sure.
Why don't you put this one down so we keep these pillows? You use this one.
Okay.
Sleep on your side.
Yeah.
All right. Now this is a lot of pillows, I understand, but this is what it takes. If you have a bad shoulder and it's on top, you're going to take one.
We're gonna do top.
No, one here first. And the second one here, or the second one could go right underneath right away. Some people could even do three, you know, yep, like that, and then like this.
I can't breathe, Bob.
Yeah.
There we go. Okay.
But see what he's done here now. If he's like this,
They can't see my face.
they don't need
Bob.
to see your face,
Well,
Brad.
Bob, someone might want to.
So, you know, you can do one, or you can do two or three,
Mhm.
but we really got that shoulder in a neutral position now, and it's going to feel a lot better.
Right.
And again, you can get by with two. I mean, two also works.
It all depends on the size of the person, the body shape, etc.
Probably use this extra one to go between the
Yeah,
legs. which
there
is
you
really
go, Bob.
important.
Now you got me comfortable.
So, all right, let's say you're one of those people that just can't avoid to sleep on the shoulder. So this is the alternative for that. So you're going to get a smaller pillow if you can, like a throw pillow, and you're going to put it right there. You don't even need to, well, yeah, you don't even need to fold it up, but you're creating a canal here
That can
for the shoulder, and you can put that right in there. Now there's a lot less stress on that shoulder, isn't there, Brad?
Here, let me get. Oh yeah, yeah. Kind of. It creates a little canal. It's a bridge. Yeah, the
Yeah.
shoulder. Now the.
So you have a throw pillow here or a pillow here, and you create the gap, and you can sleep right on that shoulder then.
You know, another thing that, even if you don't have those pillows, I think most people might realize this, but if you're like this, if you take this shoulder and pull it
Yeah.
forward like that, and you just rotate the body, you're kind of half on your side, half on your back. But that can help too if you can tolerate that.
And some people even put a pillow behind them to help keep them in that position.
Yeah.
But a little more difficult, but that's true. You're off the point of the shoulder now, and it's going to be a lot better than any other alternative. So
There you go.
how about for the low back, Brad? Are we going to go into that?
Sure. If you can take a sheet or a rolled up towel like this, okay? And I had one person just recently in the last month who got with back pain, and I had him just roll the towel, put it underneath. He had low back. He actually had sciatica going on his leg, and he put this under very similar to the way I have it right now, and it was a big difference. He said, "Oh, I'm going to do this at home when I sleep." You can take it and roll it up around you and fasten it in it somehow so that when you're on your side, it will stay with you.
Yeah, because there's a gap here too, you know, especially if you have a little wider shoulders, and it actually, the back sags then.
All right.
If you flip the other way, Brad, can you flip towards the
Sure, I can flip anyway.
So the back without this is going to sag down like this. With this, it helps hold it more straight.
Sure.
So it does work well for that. They do also make pre-made ones for that. This one's not a size that'll fit you, is it, Brad?
Well, it's okay. It's a little small, but
Oh, it does work.
yeah, it would be nicer if I was
You've been dropping weight there, Brad.
well, I should drop another 10 pounds and it might fit, but they make them for all different size people.
Sure.
But yeah, this way, it's just a little more comfortable.
Is that a Mackenzie too?
Yeah, this is a Mackenzie
So
night roll or sleep
Mackenzie
roll.
sleep roll.
Sleep roll, yeah.
So,
Sorry. Yeah.
and again, when he sleeps on his side, he's got support there. And again, that must be a small. I know it fit on Lonnie that time, but.
Right.
So, should we also show, you can try putting your legs up on pillows.
Sure.
It takes off some of the stress off the back a lot of times. But what we have found, to be honest with you, if you find this helps at all, we find the leg wedge works a lot better.
The leg wedge is wonderful for most people.
Shoves that in there.
Once in a while, I find someone that's not comfortable with it, but not too often.
Yeah, most people really like it.
Now, if you're in the throes of back pain, this is what I personally do. And I have, as a matter of fact, I just did this with someone in the clinic before they left. They took my gel cold pack and put it right under here while you're on the leg wedge. And you're in a comfortable position. You can relax and you let that sore back get cooled down.
Yeah, I have found some of my patients who are in the throes of back pain, Brad, they sleep in a recliner. I really would like them to try this instead.
Sure.
Because the recliner, it's just your back is in a little bit of flexion. And I think they would get by with this if they would try this instead. Because I'd rather not have them in the recliner.
Right, yeah, so it flexes the low back. And the nice thing about this, if you happen to have any swelling or edema issues in your legs or feet, this elevates and you're going to get those benefits.
Let's show a little sciatica trick, Brad. One, you lay on your side facing the wall.
Yep.
And this is a little trick you can try if you're getting leg pain down. Let's say he's getting pain down his right leg. You can actually take a couple pillows. Usually takes two. And believe it or not, just put them underneath the ankles like this. And it twists the back in a fashion that a lot of times it'll take the pain out of that leg. So, have you've had luck with this with one patient? Have you?
Oh yeah. More than one.
Yeah. So
it's one of those things you try it. It takes you 2 seconds to do.
Yeah, you give it a try and see if it works. So you take two pillows, put them underneath both ankles, and just see if it turns off the pain, which quite often it will do.
Sure.
So, do you have anything else, Brad? Are we missing anything else?
Oh,
We got the cold pack. We got the towel around.
Whoa.
I think we got all of them.
I think we did. We
could
quite a
probably-
list there, Bob.
Yeah. We can probably start taking some questions.
Why don't you answer some questions? I got a nap.
Someone says, I'm going to wrap myself in pillows that look like the Michelin Man. That's a good point. Yeah, that is.
Good one from Ghostbusters.
Smoking Soap's video. Let's see. Someone says, I have so many issues. I'm afraid to sleep to wake up because every day I'm in pain from back to foot. Sorry to hear that.
Yeah,
So,
I'm hoping maybe some of these will be something you haven't tried that will
Lonnie,
be successful.
you got anything over on that side?
He's asking what position he needs when he sleeps, and because he's getting a prosthetic for S1 and L5. So any position?
She's having surgery? Sounds like someone's having surgery for S1, L5.
And he have a degenerative
disc disease.
Sure.
He's often going to feel better with that wedge because that's going to gap it a little bit, isn't it, Brad?
Right. More than likely, that's something that you really have to do a trial and error. But
you're going to try.
Our guess is that something like this would be very helpful and comfortable.
You're not going to like anything that kind of extends the back. It's going to make it feel worse.
That's one thing we did miss is prone sleeping on your stomach. Some people do, and they like to sleep that way, but in general, we don't like people to do that because it puts your neck in range and can eventually cause headache problems or neck issues.
Yeah, we never generally, you don't like to have any joint of your body at end range. So what he's saying is, he's sleeping, so his neck is turned all night long. Really high incidence of headaches on people who sleep on their stomach all the time. Now, I mean, I do once in a while. I'll do for an hour, but I try not to make it a habit.
Right.
It's a good alternative to me sometimes.
Any other?
Well, Lonnie, why don't you take a look?
We have silence. Oh, Lonnie's laughing. You don't. Is it a joke?
No.
Can we say it? They're making fun of us.
I sleep mainly on my left side. I have a sore right side every morning. So do you think that's from my back sagging?
It could be. The person's saying that they sleep on their left side every night and they wake up with their right side being sore. Kind of depends what's sore. If the back is sore or what. If it's the back, I would try flipping around.
Or maybe even something here where you can fill in the gap here if it's a low back problem.
Yeah, it's easy enough to try. Just, spin a sheet and tape it and
Yeah.
pin it in place.
So he's
So,
asking if the back roll would help.
yeah, I would try it. I mean, I wouldn't buy one. I would try a
Just use
sheet.
a taller sheet, something that's
Yeah.
gonna take up space and that's gonna just align that spine more in that neutral position, eliminating that pain.
Someone mentioned that they're having trouble with SI pain at night, Brad.
Oh.
I don't know what that suggestion there. I would guess a flex position would probably be a little bit better, wouldn't you?
Yeah.
Extension is usually going to make it worse.
Yeah, SI, is oftentimes related to weight bearing as far as when it gets irritated.
That's a really good point,
Or
Brad.
it could be if you're sideline on the involved side, say your right SI, and you're laying on your right side, that may put some pressure on that ischial, the pelvis there.
Good
When
point.
you're irritated.
So I would avoid laying on the painful side.
Right, yep,
I would stay more into, like, if you lay on your side, keep your knees up into a flex position.
with the pillow between.
With the pillow between the legs.
Yeah.
Or if you're on your back, I wouldn't lay with my legs straight out. I would put pillows underneath my legs or use the leg wedge like
Sure,
this. I
right.
would do one of those. The other thing, though, the point I want to make about that, Brad, is because you're feeling pain right here over the SI,
Yep,
that doesn't mean it's an SI problem.
that's the tricky part
That's
about
the
that
tricky
thing.
part about that. Unless you've been diagnosed with an SI problem, quite often, pain that is felt here is from the low back.
Sure, it's just referred.
It just refers down. In fact, a lot of times, if you feel pain in the low back, a lot of times that's from the mid back.
Mm-hmm,
So the problem is here, it sends it down to here. If the problem is here, it sends it down into here.
right.
If the problem is a herniated disc, it goes way down.
I hope
So-
they can hear you facing that way, Bob.
I hope they can hear me too. I can see the light going up and
Yeah.
down. So,
So somebody's asking about
Tendonitis?
it's tinnitus.
tinnitus, the ringing in the
Oh,
ear.
tetanus, oh, yeah.
Yeah, tinnitus is a real bear. There's no cure for it. A lot of people just try to deal with it. They use the
Yeah.
white noise quite
Sure.
often.
That's a little, we don't particularly treat that. I never have, I don't know.
No, there is no treatment for it. In fact, I just asked the doctor column about it. And-
Okay.
and I have friends that have it. It is a function of aging. It is a function of people that maybe listen to loud noise too much or were exposed to loud noise
Sure,
too much.
sure.
So, and unfortunately, there are really no drugs to
Yeah.
either. It's
right.
just, it's a bear, tinnitus. I'm really
Yeah.
sorry to hear about that you have it. So,
Any remedy for restless leg syndrome?
yeah, this one here kind of talks about that too. Restless leg syndrome, no, there's nothing that we can do. There's medications that
Mhm.
I've had some people that definitely have helped.
Right,
You need to ask your doctor about that, but there's no cure that we can come up with or even position.
right. That's another tough one.
Yeah, it
That's
is.
out there.
We can help with cramping at night.
Sure.
A lot of times we talk
Yeah.
about, stretching the leg beforehand and keeping the pressure off the foot
Right.
at night, so.
That's quite a difference from.
Yeah,
restless leg.
I know, but I thought I'd segue into it.
Sure, yeah, we might as well throw something in there we can help.
I have something in my low back. I stretch every night. So. Some people are kind of giving their advice. I don't feel pain in my buttocks, but when I massage them with a towel, it does help it settle down for
Sure.
a while.
Yeah, if you've got an idea that works, share it with everyone else. It's,
Yeah.
we're all here to learn something new.
Anything
especially
else
Bob
on
and
your
I.
side, Lonnie?
Yeah.
You good? Okay, I'll check one more over here. If we're
One
not-
more? Going.
I think we're going here.
Gone.
All right, but before we leave here though, I just want to mention that we're trying to go live every Thursday at around 11. Sometimes, yeah, we run into technical difficulties. Apparently last night when I set this up, I said 9. I apologize for that. We also apologize that Brad and I are not able to answer your individual questions during the week on the comments.
Right,
We see a lot of them, but we're just deluged with them. I mean, we're getting
the volume. is-
the volume. Brad and I still practice full time, so we're just doing these on the side. So we're trying to fit it all in. So,
Right.
So these are a good time to come in and ask your questions.
Right, yeah, so I can just feel the energy, Bob.
That's right. All right. Well, we'll see you next week.